Executive Plastic Surgery, Bloomfield Hills, Michigan. So a very interesting case, nice patient. Just exactly 2 weeks and 2 days ago, she called my office emergently, basically saying that she had what was an MRI that showed right and left breast implant rupture. So she had implants. She's 65 from California. And so she had implants on the right and also on the left, just one set from 2014. So 11-year-old, what are the nicer, better, safer gummy bear implants? And so she had what was a grade 3 contraction on the right, grade 4 on the left. And as you will see right here, she ended up getting what is a complete end block 9/24/25, initials SG. Now, as you can see, I removed a lot of the skin for the aesthetic contouring, if you will, full thickness. And this is where the breast tissue was lifted up and medially and also superiorly. Now, this is the soft tissue that I removed on the side. And as you can see, look at the way it looks like, as if it's like half of a implant. And it's being contracted. And you can see, look at the way it's protruding out. And a lot of inflammation. And as I touched over here, you can see there is basically induration. There's thickened soft tissue. It's not normal, all healthy. Remember, the MRI showed that this was an intracapsular rupture. That means all contained within. If this is when someone finds out that their implant is ruptured on an MRI, this is when you do not want to be doing contact sports like basketball or going to the gym, because you don't want to traumatize it and then press on it or have something hit it, and now it basically becomes extracapsular, meaning outside. So everything was contained. I'm overall very happy. Blood loss was literally 5 cc's, and there was a lot of contouring that was done, as you can see. So as I go in, look at this tissue. This is the hard indurated tissue. I'm going to go in from here. And I am going to cut through here to see exactly what is the status. Done all end block. And as I go in, you will see right here, I'm actually going to take the ruler and I'm going to put it right here so you can see this is how literally thin that capsule is. No matter how thin the capsule, you want to do it in a very controlled, contained way such that none of this internal contents come out. And this is the whole purpose behind the end block. So everything is all contained. So as I go in, you can start seeing what is the status of this implant. So as I dissect this open, very thin capsule. This was a tricky case. And remember, the surgeon has to always assume that the implants are ruptured to prevent otherwise. You do not want to find out otherwise. So as I go, I'm going to move this aside. So indeed, what is a ruptured implant? And you will see this is the internal calcification. Look at the scales of a fish, if you will. This is how sharp this is. And the entirety of the implant capsule has been removed. I'm going to send this. So nothing out of the ordinary other than the very thick tissue. Remember, the body's trying to wall this off, and indeed what is a ruptured implant. All contained, none of this spilled into the chest. And as you can see, look at this. You know, this is supposed to be the gummy bear. No, it's not. So as you can see, none of this spilled into the chest, none of this. She went and she studied me, and she literally knew. She got the clearance in the fastest time possible. And I was able to add her on as a third case today, just so that we could accommodate her. And you can see this is not spilled into the chest. So this is your, and I'm going to read the numbers here. 270, just like the patient very well stated. Allergan, 270. And she was hiding this very well in her chest. So now I am going to go ahead and remove my sterile glove, the top one, and I have another sterile glove at the bottom. You know, I have seen this from a lot of patients that I've talked to. There is no mention of the date or the patient's initials. You want to see exactly what's going on. This is indeed your case. Full thickness, as you can see, contouring, given the severe pedunculation of that implant that was literally falling down. This tissue I'm going to send along with the capsule because it was in the proximity of this. And you can see, look how bent, irregular this is. This was towards the bottom. It literally looked like a heart. And as I remove this again, you can see how thin the capsule is right here. So a lot of inflammation, all of this inflamed tissue was removed. Remember, it's not only the implant, but the capsule, but this inflamed tissue. And I'm going to show you right here as I go in. This tissue is not looking good. It's not looking healthy. So you do not want to just remove this and say, I'm going to leave this precious volume behind, because you can see as I go like this, it does not look healthy. So if I go like this, you can see it has that frothy appearance. It is unhealthy tissue, inflamed tissue. So this has to be removed as much as the capsule, which is this white capsular tissue. So I'm going to go ahead and go in. So implant capsule and this tissue as well, because you don't want to leave any burden behind. And there's a certain finesse into doing this surgery so that if there is extra capsular rupture, it's all contained. So this tells you again, all of this tissue is bad. You can tell just by looking at it. And if you look at this, analyze this, you will see it's going to have components of inflammatory cells and what is suggestive consistent with gel bleed. So as I go in, I'm going to find a good access point. There you go. Again, you will see, look how thin this tissue is. The body in itself is doing a good job trying to protect itself. And look how suffocated, contracted. This was a grade 4 contracture, the highest of its kind. Distortion of the chest wall. And again, I just want to show you, if there was any fluid, it was all contained inside. Look how you can see my green glove. This is a capsule that's relatively different, and if I go like this, you can see it's like literally the scales of a fish, if you will. So very, very thin capsule, all contained, and as you will see right here, bilateral ruptured implants. 20 years from now, look at this. All right, and this is not that safer, cohesive implant, because if it ruptured out, you don't want this to spill into the chest. And you can see the way it is literally like slime. So, and if you look at this kind of shows you exactly why end block is the gold standard. There is no other better way. If there was fluid inside, this was going to be all contained. The entire implant capsule, all of that inflamed tissue has been removed. The implants will be returned to the patient. This is your 270 as well, Allergan, it says on it. Implants will be returned to the patient. Capsules to be sent to pathology, rule out that rare BIL, CD30 analysis, rule out lymphoma, rule out malignancy, cultures for aerobic, anaerobic, and fungal, and no need for lift at this time because there was severe inflammation present. No need for drains, and overall this nice 65-year-old lady is actually going to relatively do very well given the pseudo lift that she had. And I'm very happy and content. She will get complete removal of the implant capsule, as you see, and a complete workup, cultures for aerobic, anaerobic, and fungal, capsules to be sent to pathology, and she has that peace of mind and that tranquility that all of it was removed and all of it is being tested just like we discussed. And again, I would say this 20 years from now, I cannot imagine anyone else doing the surgery any differently because we do not know what the internal contents are. And look, these implants are just 11 years old, and this goes on to showing you that if you look at the Mentor advertisement, the Mentor website, they tell you get an MRI for silicone implants at year 3, and then every 2 years they're onward looking for a silent rupture. This patient had pain as I was marking her on the left breast, and no one should have to live with pain. Majority of the times that the implant does rupture, it's a silent rupture, so the patient does not know that it is even ruptured. No one should have to live with a ruptured implant because there is an urgency into removing it. We don't want the silica to basically go into the periphery. That's why they're telling you to get the MRI to begin with, right? And so there you have it. The other thing I just want to mention here is once you find out that the implant is ruptured, you do not want to do contact sports, physical activity, strenuous activity. You want to protect because you do not want that capsule to kind of break and this becoming an extracapsular rupture like I was saying initially. So there is kind of an urgency into removing those. And so there you have it. This is Dr. Khan, Executive Plastic Surgery.